This is a big deal. So I get it. We're all tired of not being able to go out and do the things we want to do. We all want to go out to restaurants and spend time with our friends and families. I'm not immune to that. I absolutely get it. I know a lot of us don't like these preventive measures, but we have to take them seriously now more than ever because we've reached a fork in the road. As we've all seen over the last month, our case numbers are continuing to increase at a concerning rate, especially here in Denver. There are a few factors contributing to that rise, not the least of which is the number of returning college students who are coming back from their summer breaks. And that's where we're seeing at least a large number of our outbreaks. I want to thank our higher education partners who have moved quick to tamp down on the activities that have led to this outbreak. We're also going to hear from Superintendent Susana Cordova in just a few minutes to update the community on DPS's plans for the fall semester. Every new infection, no matter that person's age, or if they're in an at-risk category, has the impact on how soon we can open up more of the city. So here's where we are right now. Our 7-day average daily case rates, which are above 127 right now, are as high now as they were at the height of the pandemic in May. I want to say that once again. Our 7-day daily average case rates, which are at 127, are as high right now as they were at the height of the pandemic back in May. Our positivity rate is about between 4 and 4.5%. The rate has risen steadily over the last several weeks. Anything over 5 is going to mean a great deal of trouble for us here in Denver. And here's a concerning one. During the week of October 3rd, our 7-day average of hospitalizations was at 126. Today, just a week later, the average is 174, a 37% increase. We are at a fork in the road, and here's why the path we choose is so important. Level 2, Denver is currently in a safer at home level 2 on the state of Colorado's dial system. Level 2 means increased capacity in our restaurants and small businesses. That's important for them to keep their doors open and employees on the job. It's important for our overall economic health. Level 2 means we can also seek site-specific variances from the state for outdoor events and venues. Our schools can do some in-person learning, taking pressure off of working parents. But let me be clear. If our numbers keep going in the direction they're going, we could be forced to go backwards to level 3. And that means our capacity in restaurants, retail businesses, event spaces and personal services, among others, get cut in half. When so many businesses right now are struggling just to stay open, that would mean absolute devastation to those businesses. For working parents, it could mean having their kids back to full-time remote learning. And not every parent has the benefit of working from home. It could mean, folks, more job losses in our economy. We're in another make or break moment here, and that's the situation we find ourselves. Our city and our residents can't afford a setback. We need everyone to keep wearing their mask and avoiding gathering in large groups by any measures. Once again, wear a mask and avoid gathering in large groups. In fact, we're going to say, as we said back last spring, we need people to stay home as much as possible to lessen the opportunity for this virus to keep spreading to other people. We will crack down further on activities that are driving this increase because ignoring health orders and making poor decisions affects everyone in the city. Every single one of us doing what we need to do is the only defense we've got right now for getting COVID under control and stopping it from spreading to our family, co-workers, and neighbors. And we all know, of course, the flu season is upon us as well. It's never been more important for everyone to get their flu shots. And I want to encourage everyone to do that. You know, there are places you can go to get a free flu shot. Today, I will be administered a flu shot by Walgreens. And Walgreens is offering flu shots to people for free. And I want to encourage folks to seek out those opportunities as soon as possible for yourself and for your family. Dealing with one virus is difficult enough. Dealing with another, which is easily preventable, just causes more challenges, especially for our hospitals. So again, as soon as you're able, I want to encourage folks to make plans to get your flu shot and keep yourself and your family safe. I want to bring on, of course, Executive Director of Public Health and Environment, Bob McDonald, with more on data and trends that we're seeing here in Denver. Welcome, Bob.
Mayor, thank you. Thanks everyone for being with us this morning. I want to share some visuals here. If I can get confirmation here that we are good. Everybody can see what I'm showing. Okay. So as the mayor said, you know, we are having more cases right now than we have had since the beginning of the pandemic. Our case rate now changes every day. Our 2-week cumulative case rate is 231 cases, meaning that if you add up all the cases that you have every day for 14 days, divide by 14, that's our average. Some of this is likely stemming from decreased physical distancing, part of the holidays. Viruses tend to do better during flu season. But we're going to need to implement things at the local level to get this under control so that we don't have more restrictions put upon us. You can see right now, we are at safer level 2, but some of our metrics, including case rates, would suggest that we should be in a more restrictive level. Hospital rates are stable, but up, much higher up than we, of course, would like them to be. And our positivity rate is increasing. So we need to, more than ever, double down on face coverings, double down on physical distancing, or all of us will need to stay home as we did in early March and April under the stay-at-home order. What could happen? It's already been mentioned. Businesses of all types, your gym, your favorite salon, your favorite restaurant, all could be restricted. We all could have to stay home if numbers keep going in the same direction. We could have reduced capacities in manufacturing and office settings, a wide range of retailers. To avoid those things, we want to, at the local level, and we'll be doing this week, implementing more public health controls to, again, double down on face coverings, double down on physical distancing to the extent that we can implement things that don't have those harsh economic impacts. Whether or not you believe in the science of face coverings, I want to touch upon that right now. Face coverings work. They work. Science has proven that. You can see some diagrams here I want to touch upon just a moment before I move on here. Without face coverings, the diagram on the left does a good job at depicting how small droplets, viral particles can spread. The heavier ones will drop, the larger virus particles will drop, but the smaller virus particles can spread for a long distance, even just through breathing. And in fact, they can hang in the air for a number of hours. But if people wear face coverings, you can see on the right side how science shows that that face covering keeps those virus particles close to us. They do not get spread out or expelled out many, many feet to where other people could be exposed. This is not Bob McDonald saying this. There are many scientists, high-level public health professionals that have stated this over and over again. In fact, I saw a quote recently that from a high-level ranking public health official who said right now, face coverings, that is our vaccine. Until we get a vaccine, if everybody could wear a face covering when they need to, we wouldn't be dealing with this right now. I've seen quotes along those lines. And remember, face coverings are for everyone else. You might think that you can withstand the virus. You don't need to wear a face covering, but face coverings are meant to protect everyone else that you might come in close contact with. Face coverings are tough to wear. I get that they're inconvenient. We forget them. We go out and run errands. We forgot to bring our face covering. Now we have to go home and get it. There are many retailers, though, that provide face coverings at the door so that you can still get in. But remember, there are still so many things we can do. Virtual games, even physical games, outdoors, provided we can physically space and wear face coverings. We can go on bike rides and go out to your favorite restaurant. I eat out 2 or 3 times a week. Never had the virus, but I wear my face covering when I go in. I wear it to my table. I take it off when I eat. I put it back on when I leave. There are many, many things we can do as long as we follow the public health guidance for each of those venues. There are things that we absolutely cannot do. I've seen this even in Denver here over the weekend, large gatherings in parks, large gatherings in various venues, much like the pictures you're seeing here, where people are not wearing face coverings. That's a problem. That's why we're seeing this spike in numbers. So please, you need to wear face coverings. I want to talk a little bit about influenza. Millions of people get influenza every year. Hundreds of thousands of people will go to the hospital because of it, become sick and have to go to the hospital. Can you imagine adding those numbers on top of the numbers that we're seeing already with hospitalizations due to COVID? Some people think that, well, I got the flu shot one year and I got the flu because of it. That is not possible. The flu shot is an inactive virus. You cannot get the flu from getting the flu shot. It's possible that the flu shot didn't work this time, or you got a different type of flu that the vaccine wasn't targeting, but it is impossible to get the flu from a flu shot. It's also possible that a person was already exposed to the flu and they were incubating and they just happened to get the flu shot before their virus kicked in. Even if you get the flu shot late, and it's not too late to get it, but even if you got it a little bit late, if you did get influenza, there's a very good chance that that the symptoms that you experience will be lessened. Best time to get a flu shot is now, certainly by the end of October. So many places where you can get that done for free. Please go out and get that flu shot. And then last word about Halloween here. Some tips for Halloween. Please, this is not the year to go out in large numbers. Go out with your family members. Do not participate if you've had anyone in the household who's been ill recently. It's best to, whether you're going out or you're handing out candy, only do that if you're feeling well and you haven't been exposed to anyone who's been ill recently. And probably the biggest message I have along these lines that's not on the slide, do not party. Please enjoy Halloween with your family members, those you live with in your own household. This is not the time to have large parties of young adults. So with that, I will turn it back over to you, Mayor.
Thank you, Bob. Very informative, and we'll be back with you and with some Q&A in just a moment. You know, listen, as DPS prepares to welcome back some of their students this week, we're very proud to have with us today our Superintendent of Denver Public Schools, Susana Cordova. Superintendent, welcome.
Thank you, Mr. Mayor, and thank you for this opportunity to share a little bit about the experience that we're having in DPS. Our leadership team in DPS spent a lot of time over the weekend examining the case rates and talking with Denver Health to consider the implications of the COVID conditions in the city and how it relates to schools. And as we think about our community, I may be biased, but I believe that there is nothing more essential in our community than education. It is one of the most essential services that we provide in a democracy. For young children especially, the opportunity to learn in person is essential to developing the building blocks of literacy and math, and this foundation has lifelong consequences, either because it's strong and supports students being on grade level and ready for the next grade, or on track to college and career, or frankly, because the absence of this foundation dooms children to underperformance for the remainder of their lives. We've been gradually and carefully opening up our elementary schools to in-person learning over the past several weeks because we know the importance of public education for the 92,000 plus students that we serve in the Denver Public Schools. And for the most part, our reopening is going well. We have seen small numbers of positive cases and the disruptions that come due to these cases, mostly among staff. So everyone can see how it's going. Our current plan is to continue opening up our elementary schools for full in-person instruction at the start of the second quarter, which is October 21st in the majority of our schools. And we are also looking to offer a mix of remote instruction and in-person school for secondary students. That's our middle and high school students. But given the fact that we have seen limited disruptions so far in our elementary in-person schooling, and that elementary school children are significantly lower risk to COVID, and that remote learning is very hard for our elementary school students and their families, we are working to continue with our plans to reopen our elementary schools to all grades next week. And we definitely have the support of Denver Health in that plan. We're taking a closer look at our plans for opening middle and high school for some in-person schooling. Health officials have shared with us that older students are at a much higher risk of COVID, and our partners at Denver Health are asking us to be more cautious at the secondary level. We're going to be spending time over the next couple of days talking with our educators and Denver Health about our plans moving forward. The overriding priority will continue to be the health and safety of the entire DPS community. We know that students learn best and get the strongest supports when they're in our schools with their caring teachers, the school support staff, the amazing leaders that we have who know them and are so committed to giving them a great education. And at the same time, we want to make sure that we are doing our part to support driving down the COVID numbers in the city. We're extremely grateful for the close partnership that we have with our city leaders, and we'll continue to lean on their expertise and guidance as we put forth our best plans for second quarter.
Thank you, Superintendent Cordova. We're going to go ahead and turn it back over to Teresa Marchetta, who will guide us through a question and answer period.
Mayor, thank you. And if you do have a question online, if you're unable to raise your hand online, then go ahead and just introduce yourself and your affiliation for your question, please, and go ahead and ask. Any questions?
Hi, this is Esteban Hernandez over at Denver. Can you talk a little bit about those public health orders that were put in place for local colleges? Can you just talk about compliance? Because it seems like since the last time we spoke, there's been an increase in cases among the three schools that originally had them in September.
Bob?
Yeah, thank you for the question. So the orders essentially hold universities accountable for the actions of their students. But before we go any further, I want to reiterate that our post-secondary partners have been just phenomenal in getting out, doing as much as they can ahead of the school session starting. With so many public health controls that they've implemented. But we added a public health order to that to set the structure for their continued success with that. Unfortunately, we've seen some non-compliance in some sororities and some fraternities, unfortunately, and we have enforced against that, issuing a summons to those house managers, and in one or two cases actually have closed those houses. The orders themselves set the stage for monitoring their athletes, monitoring their students, holding universities accountable for following up with students that fail to comply. And again, they've really done everything they can to control outbreaks from post-university secondary settings. We'll continue to work closely with them.
Thanks, Bob. Teresa?
Thanks, Esteban. Any other questions from our journalists on the line?
Yeah, Yeah, this is Teeny Ricciardi with the Denver Post. Susanna, as you mentioned, the second quarter starts next week. So when might parents and families with middle schoolers and high schoolers in DPS know what kind of school they're going to be doing next quarter?
Yeah, thank you. We have a meeting scheduled later today with Denver Health, and then a meeting this evening with our Board of Education. So we should be within the next 24 to 48 hours be in a position to have much more concrete information about our next steps.
Thank you, Superintendent. Any additional questions?
Yes, it's Sean with CBS 4. Mr. Mayor, if I can, just because we have you here, can you please just speak to what happened over the weekend and acknowledge what happened with that shooting and what, if anything, that means for protests moving forward?
Thank you very much. Obviously, a tragedy this weekend that is still under investigation. A great deal of a review is taking place in terms of reviewing the videos and what happened, trying to understand everything. We still, of course, are taking a look at the individual who is the suspect in the case, who was not in compliance with Denver licensing laws with regards to being licensed. The security company has to be licensed. The individual security guard has to be licensed. And if you are an armed security officer, you must also have the endorsement of the Department of Safety. And we do know that this individual didn't have either of those endorsements or licenses in place. So the lack of credentials really is concerning to us. As you may know, a couple of years ago, we changed our laws in Denver. We updated the ordinance thanks to the city attorney's office. And by the way, Kristen Bronson is with us if you have questions with regards to that. And so while this is still under investigation, we do plan to pursue fully the scope of our legal power within the situation. But we'll allow the investigation to go forward. With regards to protests, you know what? First of all, as we were talking about in this call, we are not encouraging folks to come out and to be a part of any large gathering at this point in time. It's too untenable, unsafe for folks with regards to COVID-19 virus. But if marches are taking place, obviously as we did from day one with demonstrations in our city, we encourage people to demonstrate safely, to demonstrate without violence in our city, and to exercise your First Amendment right, but do it with the eye toward keeping yourself and others safe. And that will always be what we stand by. We will hold folks accountable for acting with violence and destruction in our community.
Thank you, Mayor, and thank you, Sean. Any other questions?
I do also have a COVID question.
Go ahead.
The question, are you referring to the community-based testing sites? I just want to make sure I
No,
understood.
sorry. Yeah, no, I meant just we had heard the governor talk a little bit about remote care sites, like using the convention center. What, if any, need would there be to have those sites used again?
Okay, well, I think that the governor and the mayor have been very thoughtful about the possibility of a second or third or fourth spike, and even potentially even more spikes until we get to the point where we have a vaccine. And the whole idea there, like the use of the convention centers, to be prepared for that if it overwhelms our hospital settings. And so that is still an option to use the Colorado Convention Center. That's still on the table. And I think
questions. All right, I think that does it, Mayor.
Thank you all very much for joining us. Thank you, Superintendent Cordova, and to Bob McDonald as well. Thank you all for joining us. Have a great day.